What's going on, everyone? Welcome back to the channel. It's always great to have you. Do you have any personal experience with asthma, or are you looking for more information on it? But do you truly know what causes it, the symptoms it brings, and the treatments available? In this video, we'll take you on a journey to uncover everything you need to know about asthma. Now that we're all set, let's get started. What is asthma? Asthma is a chronic respiratory disease that makes it hard to breathe. It happens when the airways in your lungs become inflamed and narrow and produce extra mucus. This makes it difficult for air to flow in and out of your lungs, causing coughing, chest tightness, and shortness of breath. Asthma can affect people of all ages, but it's commonly diagnosed in children, particularly those with a family history of allergies or asthma. So now, what causes asthma? Well, the exact cause of asthma is not fully understood. Asthma is caused by a combination of genetic and environmental factors. Some people are born with a tendency to develop asthma, and this can be triggered or worsened by exposure to certain substances or situation. These are called asthma triggers, and they can vary from person to person. But some common asthma triggers are, such as pollen, dust mites, pet dander, cockroaches and mold, air pollution, tobacco smoke, strong odors, or fumes from chemicals can provoke asthma attacks in sensitive individuals. Respiratory infections, like the cold, sinusitis, bronchitis, or flu, can also worsen asthma. Weather changes, especially cold air or high humidity, are known triggers as well. While emotional stress, anger, laughter, or anxiety can sometimes worsen symptoms, certain medications, such as aspirin, ibuprofen, blood pressure drugs, or beta blockers, may also trigger asthma in some people. Symptoms of asthma? The symptoms of asthma can depend on several factors. They may vary based on the individual's sensitivity to specific triggers. Some people have mild symptoms only occasionally, while others may have severe symptoms more often. However, there are some common symptoms many patients experience. These symptoms include: Number 1, coughing. This is one of the most frequent and noticeable symptoms of asthma. Coughing helps clear the mucus and irritants from the lungs, but it can also be a sign of inflammation and irritation in the airways. Coughing can occur at any time, but it may be worse at night or early in the morning. Coughing can also interfere with sleep and daily activities. Number 2, shortness of breath. It involves a feeling of not being able to get enough air into the lungs. Shortness of breath can make you feel anxious, tired, or dizzy. It can also limit your ability to perform physical activities or enjoy your hobbies. Shortness of breath due to asthma can occur suddenly or gradually, and it may worsen over time if your asthma is not well controlled. Number 3, wheezing. This is a high-pitched whistling sound that you make when you breathe out. Wheezing is caused by the air passing through the narrowed and inflamed airways. Wheezing can vary in intensity and frequency, depending on how severe your asthma is and what triggers it. Number 4, chest tightness. Chest tightness is a common symptom of asthma and is often described as a feeling of pressure, squeezing, or constriction in the chest. It can also mimic the symptoms of a heart attack, so it's important to rule out other causes before assuming it's asthma. Chest tightness during asthma can be triggered by stress, cold air, exercise, and allergens. Number 5, trouble sleeping. This condition is often referred to as nocturnal asthma, where symptoms become more severe during sleep. Trouble sleeping can affect your quality of life and your overall health. Number 6, fatigue. This is the feeling of being exhausted or worn out. Frequent waking during the night due to symptoms like coughing, shortness of breath, can prevent a person from getting restorative sleep, contributing to ongoing fatigue. Asthma-related fatigue is also linked to decreased oxygen levels, So how is asthma diagnosed? If you think you may have asthma, first, you should go to healthcare provider for proper diagnosis. Your doctor asked you about your medical history, symptoms, triggers, and family history of asthma. Your doctor will also perform a physical examination and some tests to measure how well your lungs work. The most common tests for diagnosing asthma: number 1, spirometry. It measures how much air you can inhale and exhale and how quickly you can exhale. You will be asked to blow into a device called a spirometer that record your result. Number 2, allergy testing. Skin or blood tests may be done to identify potential allergens that could trigger asthma symptoms, such as pollen, dust mites, or pet dander. Number 3, peak flow. A peak flow meter measures the maximum speed at which you can blow air out of your lungs. It helps track your lung function over time and can indicate airway constriction. Treatment of asthma. Unfortunately, there is no cure for asthma, but it can be managed with proper treatment and care. The treatment of asthma focuses on managing symptoms, preventing flare-ups, and improving overall lung function. Asthma treatment usually involves 2 types of medications. Number 1, controller medications. These are medications that you take every day to reduce inflammation and prevent symptoms from occurring. They include inhaled corticosteroids such as fluticasone, long-acting beta agonists such as salmeterol number 2 rescue medications. These are medications that you take as needed to relieve symptoms when they occur. They include short-acting beta agonists such as albuterol, anticholinergics such as ipratropium, and oral steroids such as prednisone. In addition to these medications, you should also follow an asthma action plan that your doctor will create for you. This plan will help you monitor your symptoms, adjust your medications, and know what to do in case of an asthma attack. You should also avoid or limit your exposure to your asthma triggers as much as possible. Keep your environment clean and dust-free. Other than that, you should also eat a healthy diet. At the end, asthma can be a challenging condition to live with, but with proper treatment and care, you can lead a normal and active life. Thanks for watching. If you found this video useful, please hit the like button and share it with your friends to spread the word.